Welcome to our channel, Health Tuner. Today, we're going to talk about essential first aid methods that everyone should know, whether you're a child or an adult. You know that knowledge is power, and in the case of first aid, it can be the power to help yourself, a loved one, or even a stranger in need. We're going to cover a range of common household emergencies, from minor cuts and scrapes to more serious situations like choking or sprains. Don't worry, we're going to break it all down in a way that's easy to understand and remember. Remember, in an emergency situation, those first few minutes can be crucial. Having a basic understanding of first aid can make all the difference while you're waiting for professional medical help to arrive. So let's get started. All right, let's start with the basics. We've all been there, a little slip of the knife while cooking or tripping on the sidewalk. Knowing how to properly treat a minor cut or scrape can prevent infection and help it heal faster. The first thing you want to do is control the bleeding. Apply gentle, direct pressure to the wound using a clean cloth or bandage. Once the bleeding stops, gently clean the wound with soap and water. Remember, clean hands are essential to avoid introducing bacteria into the cut. Finally, apply an antibiotic ointment if you have some on hand, and cover the wound with a clean bandage. Keep an eye on it over the next couple of days, and if you notice any signs of infection like redness, swelling, or pus, definitely get it checked out by a doctor. Choking is a scary situation, but knowing how to perform the Heimlich maneuver can literally save a life. If someone is choking, they will usually grab their throat. If they can cough or speak, encourage them to cough forcefully. That might be enough to dislodge the object. However, if they can't cough or speak, that's when you need to step in. Stand behind them, wrap your arms around their waist, and make a fist with one hand. Place the thumb side of your fist slightly above their navel, and grab your fist with your other hand. Now give quick upward thrusts into their abdomen until the object is dislodged or they become unconscious. It's important to remember to call emergency services immediately if someone is choking. Chapter 3. Minor burns. Cooling down the heat. Minor burns are another common household injury, whether it's from touching a hot stove or accidentally spilling boiling water. The first thing you want to do is cool the burn down. Run cool, not cold, water over the affected area for at least 10 minutes. Avoid using ice, as it can actually damage the skin further. Once you've cooled the burn, gently pat it dry with a clean towel. If the burn is small and superficial, you can apply an over-the-counter burn cream and cover it with a sterile bandage. However, if the burn is larger than 3 inches, blisters severely, or is located on the face, hands, feet, or genitals, seek medical attention immediately. Chapter 4. Sprained ankle. R.I.C.E to the rescue. A sprained ankle is a common injury, especially for those of us who are active. It happens when the ligaments that support your ankle are stretched or torn. If you think you or someone else has sprained an ankle, remember the acronym R.I.C.E stands for rest. Avoid putting any weight on the injured ankle. I stands for ice. Apply an ice pack wrapped in a towel to the injured area for 15 to 20 minutes at a time, several times a day. C is for compression. Use a compression bandage to help reduce swelling. And finally, E stands for elevation. Keep the ankle elevated above the heart as much as possible. Following R.I.C.E will help minimize pain and swelling. If the pain is severe or doesn't improve after a couple of days, it's a good idea to see a doctor. Chapter 5. CPR. Your hands can make a difference. CPR, or cardiopulmonary resuscitation, is a life-saving technique that can be used when someone's heart stops beating. While it's best to learn CPR from a certified instructor, I want to give you the basic idea here. If you find someone unresponsive and not breathing normally, call emergency services immediately. Then, if you're trained in CPR, begin chest compressions. Place your hands one on top of the other in the center of their chest. Push down hard and fast at a rate of 100 to 120 compressions per minute. Continue chest compressions until help arrives or the person shows signs of life. Remember, even if you haven't had formal training, knowing the basics of CPR can make a difference in an emergency. Outro. Stay safe, stay prepared. Thanks for watching. Make sure to like, subscribe, and hit the bell icon for more informative videos. Stay safe and be prepared. Remember, these first aid tips are just a starting point. It's always a good idea to take a certified first aid course to gain more in-depth knowledge and hands-on practice. Knowing how to react in an emergency can truly make a difference. Stay informed. Stay healthy. Like and subscribe Health Tuner.